morning, myself Pramod, lecturer, Department of Biochemistry, Subhaya Medical College, and today I am here to present my topic, effect of metformin on serum irisin and oxidative stress biomarkers in women with polycystic ovarian syndrome, an interventional study. PCOS affects 5 to 20% of the reproductive age women, and it is characterized by hypoandrogenism, ovulatory dysfunction, and polycystic ovaries. And it is strongly linked to the insulin resistance, 80% contributing to the metabolic dysfunctions, oxidative stress, and chronic inflammations. I have taken the marker irisin, a myokine skeletal muscle, promotes the glucose uptake and browning up of the adipose tissue and elevated in the PCOS also, and possibly as a compensatory response to the insulin resistance. Along with that, oxidative stress in PCOS is marked by increased malonaldehyde and decreased antioxidant enzymes like superoxide dismutase and the GPIs, contributing to the mitochondrial damage and ovarian dysfunctions. And also I have taken the metformin for the treatment, and it improves the insulin resistance and reduces the oxidative stress via AMPK and NRF2 and may lower the irisin levels, though evidence remains the inconclusive. And the objective of the study is to aim to evaluate the impact of metformin treatment on serum irisin levels and oxidative stress markers like malonaldehyde in women with the polycystic ovarian syndrome. Study setting, prospective interventional study was conducted in the Department of Biochemistry and OBG, Subhaya Institute of Medical Sciences. 40 women with a PCOS according to the Rotterdam criteria and 40 age matched healthy controls. And ethical approval obtained from the Subhaya Medical College with ethical number 62 October 2023, and it is conducted for the 1 year. And inclusion criteria: women with 20 to 40 years with a PCOS having the clinical and biochemical hyperandrogenism, oligoanovulations, polycystic ovaries on ultrasound, and other criteria are considered for the, and also no metformin prior use are included for the study. Exclusion: thyroid, hepatic, renal, cardiovascular diseases and planning to pregnancy are excluded from the study. In the interventional and the sample collection, metformin treatment for thrice a day, that is 1500 mg per day, and biochemical and hormonal assays are done by collecting the blood samples, venous blood samples, and also collected after the post treatment and separated and stored at the minus 20 degrees Celsius for the further analysis. The main biomarker irisin is quantified by the ELISA using the human ELISA kits, and also the oxidative stress by the malonaldehyde, that is T-bars, diabarbitic acid reactive substances, and metabolic parameters like fasting blood glucose, lipid profile, and hormones LH, FSH, and also the insulin resistance, and also the calculated the HOMA-IR using the formula. And the statistical analysis was done using the SPSS and the paired t-test, and the p-value less than 0.05 is considered as significant. And after that, all the treatment and the results of the study after the 3 months and also prior to the metformin use. And PCOS versus control, the baseline and the biochemical differences. There is no significant difference in related to the age between the PCOS and the controls, and PCOS groups had a significant higher that BMI, body mass index, that is 26.71 compared to that of the controls, that is 22.06 kg per meter square, and the significance of 0.001 is there, and that is depicted in the figure 1. And higher levels of the biochemical parameters like luteinizing hormones and follicular stimulating hormones, and also the fasting glucose, insulin, HOMA-IR, and lipids, irisin, and also the MDA oxidative stress biomarker, especially in PCOS, are increased in the cases. Next, impact of metformin on PCOS biomarkers. So after the treatment, that irisin is decreased to initially it was 8.35 pre-treatment. After the post-treatment, it is 6.93 nanogram per ml, and MDA also decreased at 7.29 to 6.45 nanomoles per ml. The improvements in fasting glucose, insulin, and also the HOMA-IR homeostasis model, and also triglyceride, total cholesterol, LH, and FSH after the treatment. It is depicted in the figure and 3 and 4. We can observe that in the figure 4, the before treatment the irisin level is very high, and also the after treatment it is slightly coming down, and also the LDL unchanged and HDL showed the upward trend after the metformin intervention. Next, I did the correlation analysis of the irisin and the oxidative stress with the metabolic markers. Irisin is positively correlated with the BMI and also the HOMA-IR, insulin, and LH and FBS, and MDA showed the similar trend like the irisin. And irisin and the MDA has a significant correlation in the pre-treatment, but after the treatment significant correlation was not seen because of the interaction of the metformin in the cases. And here metformin reduces the oxidative stress in the irisin, led to the significant reduction in oxidative stress as seen in the lower MDL levels, and this supports its known antioxidant actions via AMPK activation and NRF2 pathway and mitochondrial improvements. The positive correlation between irisin and MDA before treatment suggests the link between metabolic stress and also the oxidative stress in PCOS. But the post-treatment, this correlation was lost, indicating that the metformin may disturb these pathological interactions. And these findings highlights the metformin dual actions improving the insulin resistance and reducing the oxidative stress, underscoring its broader therapeutic potential in PCOS management. Metformin's effect on irisin and insulin resistance. Metformin is already known for its reducing the insulin resistance, significantly reduces serum irisin level also, and likely reflecting the improved metabolic homeostasis. Elevated irisin in PCOS is thought to be a compensatory response to the insulin resistance rather than the direct cause. The concurrent reduction in the HOMA-IR supports metformin insulin sensitizing effect, which may reduce the body's need for excess irisin productions. And this aligns with the studies of the Shen et al. And the plus KG et al. And indicating that irisin levels correlate with the severity of the insulin resistance in PCOS. However, the irisin produced in PCOS may not exert the same metabolic benefits as exercise-induced irisin, and its functional role is also remains uncertain. So conclusion, according to this study, the metformin reduces the oxidative stress and irisin in PCOS, most likely via improving insulin sensitivity and mitochondrial function. And the correlation between the oxidative stress marker and also the irisin suggests that myokine signaling and also the oxidative mechanisms interact in the PCOS. And the future research examine if irisin regulation might enhance the metabolic outcomes in this cohort.
Being a basic science paper, how do you envisage the results of your study for a broader application in the clinical setup? How does this information that you provided contribute to patient care for all clinicians?
Sir, after that there is a link between the oxidative stress and also the irisin is there, means we can better include irisin as a known biomarker for the PCOS criteria, sir. That is the one thing.
And who are the normal controls? What is the, I really
age matched healthy controls, sir.
BMI matched?
BMI, sir, it will not going to match with the PCOS cases, sir. But so many PCOS cases are always obese, sir. Some lean cases are also available, but most of they are obese. And also the thing is that due to that obesity, the levels of the irisin is also going to increase. Being a irisin exercise induced one, in BMI case also that irisin is increased, sir.
And is there any intervention which was planned in both the groups, like diet restriction or physical activity? Some means I'm asking.
Sir, which is the consent form that
because all those things also can affect oxidative stress.
Including the cases we have discussed about that all the things, whether you are doing any exercises or most of the persons are obese, sir, in that cases. That's why.
No, I'm asking about controls also. So basically, I'm asking
yes,
other than metformin.
Yes, sir.
Where the cases and controls exposed to the same intervention.
Yes, sir.
They were having the same.
Yes, sir. While taking the consent form, we inquired that all the things, sir.
Can you elaborate on irisin, its role in metabolic health?
Sir, irisin is a myokine, sir. It helps in the browning of adipose tissue and also the bone health and also the metabolic functions and also insulin sensitizing effect is there, sir, from irisin.
Which method is preferred? Is there any specific assay for irisin? You use ELISA, you told. Which is the gold standard? Is it reliable? What is the assay related?
Irisin estimation.
Irisin assay. Is it what is the gold standard assay to measure irisin? And in your study used ELISA.
ELISA, sir. ELISA method. The most widely used on ELISA only, sir. That
is it the gold standard or is there any other method?
No, sir. That ELISA only, sir. That is used for the irisin estimation, sir.
Okay. Thank you.